Hello, welcome to part 64 of Clinical Physiotherapy MCQ series. Here we gon discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 316. During examination of a patient, a physical therapist notes a red, swollen foot that is significantly warmer to the touch than the contralateral foot. The patient denies any pain or trauma. The patient has a history of diabetes, peripheral vascular disease, and congestive heart failure. The findings are most consistent with which of the following conditions? Option A, grade 3 sprain of the talocrural ligament. Option B, fractured distal tibia. Option C, bone cancer. Option D, Charcot disease. And the answer is Option D, Charcot disease. Explanation for this question is: the signs and symptoms, along with a history of diabetes, are most consistent with Charcot foot. A patient with any of the other options would have referred pain or local pain. A patient with a sprain or fracture would have a history of trauma. Now let's move to question number 317. A patient with a middle cerebral artery vascular lesion has difficulty raising his arm. Which of the following synergy patterns is most likely present in the patient's involved upper extremity during elevation? Option A, scapular retraction, humeral abduction, elbow flexion, wrist supination. Option B, scapular retraction, humeral adduction, elbow extension, wrist supination. Option C, scapular protraction, humeral abduction, elbow flexion, wrist supination. Option D, scapular protraction, humeral adduction, elbow extension, wrist supination. And the answer is Option A, scapular retraction, humeral abduction, elbow flexion, wrist supination. Explanation for this question is: the typical flexion synergy pattern in patients after a stroke includes scapular retraction, humeral abduction, elbow flexion, wrist supination, and wrist and finger flexion. Now let's move question number 318. A 19-year-old patient has a complete spinal cord injury at the level of L1. His primary goal is to walk again. You decide it would be most appropriate to recommend that this patient use Option A, reciprocating gait, orthosis and walker. Option B, a wheelchair, because ambulation is unrealistic. Option C, bilateral AFOs and Lofstron crutches. Option D, bilateral KAFOs with thoracolumbo-sacral extension control. And the answer is Option A, reciprocating gait, orthosis and walker. Explanation for this question is: a patient with a PSI at the level of L1 or above has lost all functioning lower extremity muscles needed for gait. A reciprocating gait orthosis is the best choice for this patient. Because of the high energy expenditure, patients with injuries at this level typically depend upon the wheelchair as their primary means of mobility. However, the physiological and psychological benefits make it is appropriate to train this patient in ambulation. Now let's move to question number 319. A patient recovering from a stroke is being evaluated by a physical therapist. The patient is able to voluntarily elevate his arm through the synergy pattern without difficulty, but is unable to move out of the synergy pattern. Spasticity is still present. Which of the following Brunstrom stages best describes this pattern? Option A, stage 1. Option B, stage 2. Option C, stage 3. Option D, stage 4. And the answer is Option D, stage 4. Explanation for this question is: Option D, the scale continues to stage 6 where no spasticity occurs and normal movement is re-established. And Option A, stage 1 is characterized by flaccidity and no voluntary movement on the affected side. And Option B, stage 2 is characterized by the development of spasticity and obligatory synergies that occur from the result of external stimuli. And also Option C, stage 3 is characterized by continued spasticity and limited voluntary movement through the synergy pattern. Now let's move to question number 320. A patient comes to physical therapy via direct access for evaluation of insidious shoulder pain. During examination, the physical therapist notes a yellowish color of the patient's sclera and skin. The therapist should refer the patient to a physician for probable primary dysfunction of the option A liver, option B eye, option C duodenum, option D heart, and the answer is option A liver. Explanation for this question is, the patient is exhibiting jaundice consistent with liver or gallbladder disorder. Eye involvement, sclera, is a symptom, not the primary disorder. There are no indications of duodenal involvement or cardiac involvement in this patient. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 65. See you till then, bye bye.